Hello, I'm back. This is Ed Palero again. Got my procedure done underneath my eye bag last time. Yeah, my eye bag experience last time, it was pretty easy. It went smooth, and you just gonna have to handle the aftermath, and it's pretty fast. It healed pretty fast, and now I'm back again. Now my next one is the my neck. So hopefully it will smooth out. As you get old, they get saggy. Gonna get it done, and hopefully it will help me a lot with Dr. Contessa. Don't forget to subscribe, press the subscribe, and ring the bell, and Dr. Contessa will be there for you.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's welcome back Sir Ed Palero. Yan. We did the non-surgical periorbital rejuvenation last time. We made use of our Shine, the collagen filler for the under eye. And we also used PDO scaffold threads to improve the tear trough. Then we combined it with Dermaspring IPDO on the under eye plus on the crowfeet area to strengthen, tighten, and also stimulate collagen. So that was about 8 weeks ago. How are you, Sir Ed?
Doing fine. Everything's great. So far everything is looking younger.
Yeah, and
younger.
Younger and younger. So it's reversing age. Imagine 70 plus, 70.
To 1.
Yan. Balik rin natin, sir. 17, okay?
70.
So we have a good like upper third, middle third, lower third. Now, what we noticed with Sir Ed last time was the neck area. Sabi nga, sir, neglect not the neck. Okay?
Yes.
So we also have to take care of our neck region. Yan.
Yes.
We may be young looking on the face, but the neck may give away our age.
Yes.
So over time also, the neck region, the fat tissues, the muscle tissues, the skin tissues, they also age. So there's sagginess, laxity, we may have the so-called platysma bands, we have the so-called neck wrinkles.
Turkey neck.
Yes, there you go. So we have to do something about it in a non-surgical way, because Sir Ed is a believer of non-surgical methods, as much as possible avoiding surgical cuts to also avoid long downtime.
Yes.
Yan. Plus healthy lifestyle, si Sir Ed. So that good lifestyle will also help with our non-surgical management. Yan. Healthy diet, adequate sleep,
Yes.
enjoying life, right?
Yep.
Happy life,
Happy
joyful life.
Joyful
And
life.
there you go. A complete package. So for today, we will also do a non-surgical thread lift on the neck region. We also want to target the submental area because the turkey neck appearance, we wanted to improve that. We'll make use of our threads again. We also can make use of our collagen injectables or even our collagen biostimulators. I'm excited, Sir Ed. So we'll show you when we return. And we're back. So we're going to perform a so-called non-surgical neck thread lift. We'll have our lidocaine injection here. So we'll make our entry point injection. I'm using a 2% lidocaine, and I'll just glide in the subcutaneous plane this lidocaine to numb the area. So for the kind of thread that I will use, we'll be utilizing our so-called PDO cog thread lift, the multiple bidirectional cog thread lift from the Endfinders company. So this is just injecting our tumescent anesthesia, we need to numb the area. For Sir Ed, we'll be doing combination procedure since aging is multi-layered. So we'll start working on the saggy soft tissues. We'll reposition those loose superficial fat. So I'll start with this entry point here, and I'll just glide in the subcutaneous plane. And I'm using the multiple bidirectional COG PDO thread or polydioxanone thread. So you can have a first one, and same entry point, this one here. Then we'll just glide in the subcutaneous plane. It's a semi-fanning technique here. So you want to pull the loose tissues. As to the number of COG threads, you can use more than 3 COG threads here depending on how severe the sagginess is or the laxity. So I'm just gliding and in a fanning method. Then after that, we'll just cut the extruding thread. And then I'll combine with my so-called PDO scaffold. I'll be working on the submental region here. I'll have an entry point here. So the PDO scaffold threads are multiple strands coiled or intertwined in a single cannula. The type of scaffold that we're using right now has a total of 39 strands. So the more PDO threads, the more fibroblast activation. And we need the fibroblasts to work so that they synthesize newer fibrous proteins, or the so-called elastin and collagen and even your glycosaminoglycans. So this is a thick kind of multiple strands braided type of PDO threads. Do a fanning technique. So you want to reach the subcutaneous plane. So you can place as much as 3 or 4 or 5 of these scaffold threads. So some cases really have severe laxity, so depending on the problem, you can use more of these fibrous protein strands. Okay, we'll be adding more. So I'll just direct it inferiorly. So this is working on the loose submental area. Now I can also improve the necklines here. We'll inject some of the lidocaine again. Okay, so people with this problem of sunken neck wrinkles, you can already improve them with your scaffold PDO threads. And you can combine your threads with other procedures. Like you can even add more collagen biostimulators or even your collagen injectable or skin boosters or hyaluronic. Plus also you can add your energy-based devices. I would recommend that we perform also like your radiofrequency microneedling to totally improve the quality of the skin in the neck area. So I'm using the same kind of our scaffold. So we're looking for the entry point again. Okay, there you go. So we'll just glide it in the, again, your layer 2 strands here, then we're just gonna glide. Since it's a thick cannula, you can actually use gauge 21, this is gauge 19. So I can place another one in the center. So we leave those multiple strands of threads, so they'll work in the fibroblast tissue layer. So again, because it's a thick strand, so you may want to do your twisting technique and just glide it. Then after that, we'll combine it with our collagen booster. I'll be using my so-called PCL boosters. Okay, so this is combined with the tissue fibrosis. Okay, there you go. And then you pull it out. Okay. So if you have an extruding strand of threads, it will be advisable to just cut it. Okay. Then after that, we'll combine with our suckled booster. I'll use the same entry point. So this is using this gauge 25 cannula. You can place it in your skin of the neck. So you have a tiny needle there, and then just glide it over. Okay. So we want to deliver this so-called collagen biostimulator to help restore the skin integrity, to tighten the skin, firm the skin. We want to leave those spheres molecules to help with regeneration. Okay. Then we can also again place here. For those with concerns of deep neck wrinkles, you can use this kind of injectable. But for Sir Ed, it really needs combination treatment since we have a severe laxity already. Then we'll also treat we'll also treat the neck bands or platysma bands with our botulinum toxin. We need to add the injection for the platysma bands that we have here. So this is skin boosters again. We're working on the submental area here. Again, this is a collagen biostimulator. You can do your fanning technique. So we really have the severe laxity here. Then as to the number of syringes you can use, it will depend on the need. And then I'll need one more. So we've already have like 4 ml. Then I'll just do the neck band Botox. Then as to when he could do your energy-based devices like your radiofrequency microneedling, we give time for the tissues to heal. You usually follow up in 3 months time, because collagen stimulation like happens from 4th week, 8 weeks to 12 weeks. So your energy-based device, you can do it in a month or 2 or 3. Okay, so I'm just gonna be completing this. Last time we did the so-called Cold Shine for Sir Ed in the under eye. So even the neck, you can also do your Cold Shine, your collagen injection, and inject collagen instantly. And these kinds of treatments are to kind of maintain the collagen formation. Let me now do the so-called neck band injection with Botox. Sir Ed, can you say E? Like the letter E.
E.
There, yeah. So we can see the platysma muscles. We need to relax this to get rid of the so-called neck bands. Platysma bands, the vertical lines. The neck also has so-called vertical lines. And another E.
E.
Okay. So let's just inject this. As to the number of units, there are cases that we use 40 units and more, depending on the need. Okay, so we've done the right side. Let's proceed to the left. So we have done the non-surgical neck rejuvenation for Sir Ed. We'll show the result when we return. And we're back, so let's show the result to Sir Ed. Sir Ed, we just did the neck thread lift, though it's still swollen, and because we had multiple injections of our tumescent anesthesia and some bulges because we had the skin booster injections, so we created kind of like injection of solutions in between the skin and that of the tissues beneath it. So you still notice some bumps there. Then the threads that we have
here.
Injected, they will still work because they are also collagen biostimulators. We give time for them to still work on the fibroblast cells to regenerate new collagen, new elastin, and new glycosaminoglycans to improve the quality of the skin on the neck region.
Very nice.
Still, the botulinum toxin will work on the platysma muscle. Usually, we give it like 2 weeks time. So it's gonna be like a gradual. It's gonna be a process whereby these materials that we've used, they will still work inside. They will still take effect, and we'll still see gradual improvement over time. So we're like in a kind of like some stages of doing the neck rejuvenation. We need combination procedures for this kind of neck laxity problem. So I've mentioned a while ago, Sir Ed, that we can also combine with some energy-based devices. We also need, for example, your radiofrequency microneedling to target more of the dermis layer, in addition of your like even collagen injectables to really have that, you know, very rejuvenated neck area. And Sir Ed is 71, so it's gonna be like a gradual non-surgical procedure and combination treatments that we will need for Sir Ed. How was the procedure, sir? How's the experience?
It was pretty smooth. I mean, nothing that it really felt hard on my neck. So good job.
Actually, I can already see some reduction of that bulge because over time with this the fats under the chin, the fats under the jawline, they bulge and the skin really becomes really loose, or there's laxity. Okay, so we'll still give time for it to work, to take effect, and we'll still have a follow-up for Sir Ed. Actually, he's flying back to the United States in a week, something like that, or 2 weeks.
10 days.
Or 10 days. So we'll still like have a follow-up for Sir Ed when he comes back from the US to the Philippines.
September.
Yay!
Yes.
Yeah. So, Sir Ed,
we'll have to compare from
10
years ago.
10 years ago.
I was younger.
Current.
And now I look younger.
Yeah. He was like early 60s when he started with us. So right now, early 70s. So like the 10-year period, it was like a 10-year journey with CSA.
Yes.
And Sir Ed mentioned like maintaining his look 10 years ago.
10 years ago.
Keeping his features like when he was like 10 years younger, right?
Yeah, it was a lot.
Yeah. But the good thing is Sir Ed has also healthy lifestyle.
Yes.
Skincare. He comes to CSA every time
facial.
He's here in the Philippines. There you go. He comes to the Philippines.
All the time.
He comes to CSA as well. Right.
Yes.
From USA to CSA. There you go. Thank you so much, Sir
Thank you.
Ed.
Thank you so much.
We'll still do a follow-up on him. And then we'll share with our televiewers some of your photos, the old photos. If we were able to maintain your look 10 years ago.
That would be nice.
And then we'll follow up, we'll check again on the improvement, particularly the neck, okay?
Yes.
So when we're doing non-surgical methods for the neck, it's not an easy, treatment that one time, big time, it's already too much of like that, but it's like a gradual improvement. The changes are also gradual, okay? Thank you so much, Sir Ed.
Thank you. And I'm looking forward for another 10 years.
Yeah, there you go. So 71 and up to 81, 80 plus.
Yeah.
I'm 50, ilan na ba ako? turning 53. So, pag 63 naman ako noon.
Oh, yeah.
Okay, there you go.
Okay.
Thank you.
Thank you.
So, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Sir, meron ka bang social media? Yung mga followers mo?
Ano yan? Facebook?
Edong Badong. I remember
Instagram.
that. Yeah, Instagram.
Edong Badong.
Edong Badong. Yan.
Yes.
Facebook, Edong Badong. Yan.
Yes.
So you'll see the cool Edong Badong.
That's it.
There you go. That's it. And
Very
our
nice.
clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. If you want to see the old videos with Sir Ed, 10 years ago ba?
10
Yan.
years ago.
Just look at our YouTube channel, Contessa Salvador. And thank you so much for for everyone who had subscribed already, and those who are always watching our videos. Thank you so much. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.